If you have noticed increasing belly fat, declining energy, reduced sexual performance, or rising blood pressure, these changes may not be separate problems. They may be connected by one underlying issue: metabolic dysfunction. Many men treat symptoms individually: low testosterone, erectile dysfunction, high blood pressure, fatigue. But in many cases, the root cause lies deeper in how the body regulates insulin, fat storage, and inflammation. This video is for educational purposes only. It does not replace professional medical advice. The information presented here is based on scientific research and publicly available medical data. Let's begin with a simple question. What is metabolic syndrome? Metabolic syndrome is not a single disease. It is a cluster of conditions that tend to occur together. These include increased abdominal fat, elevated blood pressure, high blood sugar, high triglycerides, and low HDL cholesterol, which is often called good cholesterol. When at least 3 of these are present, the risk of cardiovascular disease and type 2 diabetes increases significantly. One of the most visible warning signs is visceral fat. Visceral fat is not the same as the fat you can pinch under the skin. It surrounds internal organs, especially the liver and intestines. This type of fat is biologically active. It releases inflammatory molecules called cytokines, which promote chronic low-grade inflammation in the body. Chronic inflammation disrupts hormonal balance. In men, increased visceral fat is strongly associated with lower testosterone levels. Fat tissue contains an enzyme called aromatase. Aromatase converts testosterone into estrogen. As abdominal fat increases, more testosterone may be converted, contributing to hormonal imbalance. This is one reason why men with increasing waist circumference often notice reduced energy, lower libido, decreased muscle mass, and mood changes. But the connection goes further. Metabolic dysfunction also damages blood vessels. Healthy erections depend on proper blood flow. The inner lining of blood vessels is called the endothelium. When exposed to chronic inflammation, high blood sugar, and elevated blood pressure, the endothelium becomes damaged. This reduces nitric oxide production, a molecule essential for blood vessel relaxation. Reduced nitric oxide means reduced blood flow. This is why erectile dysfunction is often considered an early warning sign of cardiovascular disease. In fact, research shows that ED may appear several years before a heart attack or stroke in some men. Now let's talk about insulin resistance. Insulin is a hormone that allows cells to absorb glucose from the bloodstream. When cells become resistant to insulin, the body compensates by producing more. Over time, chronically elevated insulin promotes fat storage, especially around the abdomen. Insulin resistance also contributes to fatty liver disease and further hormonal imbalance. Common early warning signs of metabolic dysfunction include persistent fatigue, increased waist circumference, elevated fasting glucose, high triglycerides, low HDL cholesterol, mildly elevated blood pressure. Many men dismiss these numbers as borderline, but borderline today can become disease tomorrow. The encouraging part is that metabolic syndrome is largely reversible in its early stages. Evidence-based interventions focus on lifestyle. Resistance training increases insulin sensitivity and preserves muscle mass. Muscle tissue improves glucose utilization and supports hormonal stability. Aerobic exercise improves endothelial function and cardiovascular health. Adequate sleep is essential. Chronic sleep deprivation increases cortisol, the body's stress hormone, which promotes abdominal fat accumulation and lowers testosterone. Nutrition plays a central role. Diets rich in whole foods, adequate protein, fiber, and healthy fats support metabolic regulation. Reducing ultra-processed foods and refined sugars lowers systemic inflammation. Even moderate weight loss, as little as 5 to 10% of body weight, can significantly improve insulin sensitivity and hormone levels. In some cases, medical treatment may be required to control blood pressure, cholesterol, or blood sugar. Early management reduces long-term complications. Ignoring metabolic health does not simply affect appearance. It affects cardiovascular risk, hormonal balance, cognitive function, and long-term longevity. The body functions as a system. When metabolism becomes unstable, multiple symptoms appear across different organs. Addressing the root cause often improves several issues at once. If you have noticed increasing abdominal fat, declining performance, or abnormal lab results, consider evaluating your metabolic health rather than treating each symptom separately. Monitoring waist circumference, blood pressure, fasting glucose, and lipid profile provides valuable information about long-term risk. Early awareness allows prevention. Metabolic health is not about extreme optimization. It is about stability. And stability supports strength, hormonal balance, cardiovascular protection, and quality of life over decades. Understanding these connections empowers informed decisions. Knowledge reduces uncertainty, action reduces risk, and long-term health is built on consistent, evidence-based habits.